Hi, welcome back to our nursing procedure demonstration. This time I'm going to demonstrate to you how to prepare and how to give medications, which is bronchodilators, to our patient through nebulization. After thorough hand washing, I gathered my equipments, which are the nebulizing kit, a 3cc syringe with the needle, the medications ordered by the doctor, which is the Ventolin, the Atrovent, and normal saline to be diluted with this medication. Okay, always remember the 6 rights before giving the medication. The right medication to the right patient, the right dose at the right time, and the right approach to your patient. Now let us prepare our medication. Let us open the nebulizing kit. This is the kit, the oxygen hose, and this is the face mask. Okay, you have to select the size of the face mask or the kit according to your patient. There is a small one for pediatric patient and a big one for the adult patient. Okay, and then open your needle and syringe and connect it. Okay, loosen the plunger and then open the medication and check. As I said, we have always to check the name and the label of the medication, the expiration date, and the cloudiness of the medication. Okay, the doctor's order is 1 ml of Ventolin, so we have to get 1 ml of this medication. Okay, so it is 1 ml, and we have to put it inside this kit. 1 ml. Remember that the cover or the cap of this bottle should always be top side down to keep it sterile or not contaminated. And then open the Atrovent, and then like when you are getting medication from the ampule, so the same thing from this nebule, you have to get 1 ml as the doctor ordered it. 1 ml of this Atrovent, and place it or pour it inside the kit. Okay, and then open the normal saline from the nebule, and then also get 3 ml of this normal saline, which is according to the doctor's order. So 3 ml of normal saline to be added to the medication. Okay. Never recap the needle if you are going to throw it. Okay. Never recap the needle if you are not going to use it again. Just directly throw it to the shot box. Okay. So now we have to assemble the kit, connect the face mask to this kit or receptacle of medication, and then connect the hose to this part of this medication receptacle, and this other end to be connected to the oxygen supply. Okay, we are ready now, so we can go to our patient's room. Okay, let's go now to our patient to give this nebulization. Of course, we have to identify our patient correctly by asking his or her name. Sister, what is your name? She said, I am Aisha. Okay, can I check your identity band? Okay, Aisha Ali Al-Shamari. So this is the correct patient. Okay. Also, before we start with giving nebulization, we have to check the patient's oxygen saturation to determine the pre-nebulization oxygen saturation. Okay. Okay. Aisha, I will check your oxygen. Okay. So, from the machine, it shows that it is 93%. So, the oxygen content of her arterial blood is a little bit lesser than normal, which is 95 to 100%. Okay. Then, Aisha, we have to explain the procedure to our patient. Aisha, I'm going to give your medication through nebulization. And then she said, okay. Position the patient into a semi-sitting position or Harry Fowler's position if it is not contraindicated. Actually, this is the best position for the patient having respiratory distress because it can help in lung expansion. And then, connect this hose or this cannula to the oxygen nozzle in the mounted oxygen here in the wall or on the wall. Okay, so it is now connected here. Open the oxygen and place it up to 5 to 6 liters of oxygen. Make sure that it is open before you connect it to the patient or to place it to the patient's face. This metal on the mass of this nebulization kit should be adjusted and fitted to the patient's nostrils so that there will be no escape of medication what we report. The Aisha, okay, let's place it your face. And adjust this one to the patient's nostrils. Okay, make sure that the tie is not too much tight but not loose. Okay, secure the patient. You can leave the patient for some time while the medication is ongoing. And then you can come back after few minutes, let's say 20 minutes to 25 minutes, and see whether the medication is finished. When there is no more sounds, it indicates that the medication is already finished. Okay, let's say 20 minutes is done, the medication is finished, then we have to switch off the oxygen. Okay, then remove the mask from your patient. Of course, we have to wear the gloves to protect ourselves from any secretions coming from the patient's mouth or nose. And then, okay, remove it from the oxygen supply. Okay, and discard this nebulizing kit as well as your gloves to the yellow bin. Then we have to come back to our patient after 10 minutes to recheck the oxygen saturation to be recorded as the post-nebulization oxygen saturation. Okay, let me discard first this yellow bin. And then 10 minutes is over or 15 minutes is over. Aisha, I'm going to recheck your oxygen saturation. And she said, okay. How are you feeling now, Aisha? She said she's a little bit comfortable. Good. The oxygen saturation now is 97%. So after nebulization, our patient's oxygen saturation improves, meaning to say the amount of oxygen in arterial blood is increased. Okay, that is how to give medication through nebulization to the asthmatic patient.